Well, thank you so much, Gary. I really appreciate you jumping on this call. We've got a lot of questions from users around hypnosis, smoking, their general sort of quitting journey. And I think it would be amazing if you could give us just some answers to some of the most common questions that we receive.
Sure.
So I wondered if to start with, you could just give a bit of an introduction to yourself.
Sure. So I'm Dr. Gary Elkins, and I'm a professor of psychology and neuroscience at Baylor University. At Baylor, I'm the director of the Mind-Body Medicine Research Laboratory that is basically focused on conducting hypnosis research, such as randomized clinical trials, investigating the uses of hypnosis interventions for problems such as stress, menopausal symptoms, and of course, for smoking cessation is a part of the focus of the research. I've been involved with hypnosis in clinical practice and research for most of my career. So that has led to, currently I'm the editor of the International Journal of Clinical and Experimental Hypnosis. And in the past, I've served as president of the Society for Clinical and Experimental Hypnosis, as well as the American Society of Clinical Hypnosis. I'll get a plug in for my book, the Handbook for Medical and Psychological Hypnosis, which is one of the most comprehensive research-based textbooks on hypnosis and clinical hypnosis interventions.
Cool, fantastic. And I know it's been fantastic for us to work with you in building out the Finito program, and your short intro really sort of speaks to your experience in that area. To start with, I would love to just understand, why is quitting smoking so hard?
Yeah, so quitting smoking is hard. It's difficult, and there are several reasons for that. First, nicotine is an addictive substance, and so any substance that is addictive, if you stop, you quit smoking, withdrawal symptoms occur. And so those withdrawal symptoms include things such as craving. It can disrupt a person's sleep, their mood, and so on. And so that withdrawal period is difficult for most people to go through. And then there is also a psychological dependency. A person who has smoked for a long time, they can get the idea that they need cigarettes. Like, it's hard for them to imagine going through life without smoking. And so there can be a lot of triggers for smoking, stress, or just, it's part of the person's everyday lifestyle or their work, their social activities. And so all of these things come together to make smoking difficult. And it's for that reason the Finito program really focuses on how to make this process easier, how to get through that withdrawal phase as you stop smoking.
Mm-hmm. And then is smoking, could it be considered just a habit?
So smoking is not just a habit. It is a habit, that is a part of it, meaning that a person who smokes, they've smoked many times in many different situations. And so if you watch television and you smoke, well, television and smoking get associated. But habits are pretty easy to break. And so that is an aspect of smoking. It's a habit, but that aspect, it fades away pretty quickly once the person is able to get through withdrawal and really get through the psychological dependency to really get through those initial phases. A good example of how easy habits are to break is that in United States, we drive our car on the left side of the road, on the right side of the road. But if you go to another country, you have to drive on the opposite. But most people are able to negotiate that pretty easily. They can get over that habit. And the same is true for smoking.
Mm. So then, could I just quit smoking by going cold turkey?
Could you stop smoking just cold turkey? Well, some people can. It's possible. Most people, especially if they are a chronic smoker. So, most people, if they've been smoking, they want to stop smoking. And so the idea of, I'm just going to go cold turkey. But if the person has smoked for a long time, or if they're smoking a lot, a couple of packs a day, that's a big leap to go from smoking that amount to zero all at once. And so for that reason, most people are going to have more success if they taper down, or if they stop, and if they lapse, then restart the program, stay with it. But most people, if they taper down over the course of about a week, they can get down to smoking somewhere in the range of 4 or 5 cigarettes a day. And so by using that tapering approach, most people are able to have more success. And it also gives you time to prepare to stop smoking. So, you have to be like psychologically ready to stop smoking. So I guess one thing that comes to my mind when I think about, what's the best way to stop smoking, cold turkey or taper down first, is that there are stages of change, or stages for readiness for change. And so in the first stage, it's where a person, they're thinking about stopping smoking. It's on their mind, but they're not really like fully committed to it. They're not ready to go through what's required. And then there's a second stage where the person, they're recognizing that smoking has the negative health effects. And so that's where a person, it's almost a wish though. I wish I could quit smoking. They're not fully into it. And then there's a third stage where the person, they're getting honest with themselves, and they recognize that to continue to smoke, it's probably going to have a bad effect on their health. It can affect, their loved ones, people that they care about. And so that's where the person makes attempts to stop. And even if those attempts aren't successful, they're trying. And then there's the final stage, and that's where the person, they're honest with themselves. They've recognized the bad effects of smoking. They've done the work to get a plan, to figure out, okay, what is it really going to take for me to stop smoking? What's my program? What's my plan? Most people are not able to stop smoking without some assistance. And so that's where the person is ready to then set a stop date and really stay with the program. Persistence pays off in that final stage.
Mm. And so, Finito is a hypnotherapy based program to help people in that stage. Could you tell us a little bit about, what is hypnosis and what is hypnotherapy?
Sure. So hypnosis is defined as a state of consciousness involving focused attention and reduced peripheral awareness. And it's characterized by an increased capacity for response to suggestions, for alterations in sensations, thoughts, feelings, and behavior. So if you think about that definition, that is the consensus definition from Division 30 of the American Psychological Association. If you think about that definition, if you kind of break it down, it explains what hypnosis really is. So first, it's a state of focused attention. And so it's a very natural state. We all experience states of focused attention. Examples would be getting absorbed in reading a book, or we go to a movie theater, we focus our attention on whatever is happening on the movie screen. And within that state, we're absorbed. We're open to the suggestions, even if those suggestions, are something that's being played out on the movie screen, a story or so on. And for that reason, usually in hypnotherapy, we utilize not just direct suggestions, we use words, but also mental imagery so that the person can visualize and experience the things that are being described or the goal. And so that's really hypnosis. Hypnotherapy really means utilizing that hypnotic state for a therapeutic purpose. So whether that's to help the person manage symptoms of irritable bowel syndrome, or sleep better, reduce menopausal symptoms, or stop smoking. And so the way that I think about it is hypnosis plus therapy equals hypnotherapy. And so it's really applying that state, utilizing it for that therapeutic, that positive purpose, whatever that might be.
Mm-hmm. And when a lot of people think about hypnosis, they might think about sort of stage performance. There's a lot of movies and with sort of hypnosis as a theme. I wonder if you could talk a little bit about the history of hypnosis, and especially the sort of scientific discoveries that we've had over the years.
Yeah, so the history of hypnosis, I guess I think of the history of hypnosis that there are really two histories. And so one you mentioned, so there is a history of hypnosis that has to do with entertainment. The way hypnosis is portrayed in stage shows, or even, someone can go to a magic show or a hypnotist show. And that type of portrayal, it goes back many years. I mean, all the way back to the 1800s, there's been magic shows and hypnotist shows. And so typically in that portrayal of hypnosis, it's a hypnotist who brings different people on the stage. They're told that they will be able to be instantly hypnotized, and that they will then perform whatever the hypnotist says that they will do, whether it's sing or quack or whatever it might be. But that's part of the history of hypnosis, and it's okay. I mean, that's out there, and it's okay for people to be entertained. But most people know that history of hypnosis is different than the medical scientific history of hypnosis. And so really, if you trace that history, it really beginning in around the 1930s, perhaps earlier than that, there began to be serious study of hypnosis. Like, what is it exactly? How can we measure hypnosis? How can it be applied to therapeutic purposes? And so that research really began with research laboratories being established at major universities in Germany, Australia, in the United States, as well as the United Kingdom. In the United States, Stanford University and Baylor University are currently centers for hypnosis research. The history of scientific medical hypnosis has really identified hypnosis as a mind-body therapy. And so it shares some similarities and some differences with other interventions such as mindfulness, biofeedback, progressive muscle relaxation, guided imagery, and so on. But it's a mind-body therapy that has its applications, and it's something that a person can learn how to do so that during a typical hypnosis session, the person is treated in a very respectful manner. Usually the person is guided toward a deeply relaxed state with their eyes are closed. And then various suggestions are given, including mental images that are directed toward empowering the individual, empowering them to achieve whatever their goals might be. And so in that empirical line of research, hypnosis has been shown to be among the most effective psychological approaches to such things as pain management, improving sleep, treatment of irritable bowel syndrome, and then I hope we'll talk more about smoking cessation because that's also another area where hypnosis has been shown to have a good track record.
So yeah, Gary, can you talk a little bit about, how hypnotherapy for quit smoking works and how effective is it?
So how does hypnosis exactly work to help people stop smoking? And then what does the research show? How effective is it? Two great questions. So hypnotherapy for smoking cessation, it's really a multi-component approach. So there's that first part in which the person sets a stop date, a date to stop smoking. And so that individual is going to experience some withdrawal symptoms as they have stopped smoking. So during the early phase, practicing self-hypnosis can be very beneficial to the person to help them cope with and reduce the withdrawal symptoms, to cope with the symptoms of craving for nicotine. So those cravings for nicotine, they'll always pass. They kind of come in waves. And so if the person is familiar with hypnosis, then they would know, okay, I'm craving nicotine, so I need to go have a hypnosis session. And so practicing self-hypnosis. There's also the aspect of motivation. And I mentioned the psychological dependency. And so as a person progresses through using hypnotherapy to stop smoking, part of that process is seeing themselves as a non-smoker. The person begins to change their lifestyle and begins to imagine the future without cigarettes. And so you're imagining being in different situations and dealing with different situations. Third is really stress. And so stopping smoking is a stressful process, but also many people use smoking because they think it helps them cope with stress. And so there is a very strong evidence of utilizing hypnotherapy for stress management. And so the person learns another way to cope with their feelings other than smoking cigarettes. These are essential. These are so important. And so as the person progresses through this process, their confidence increases. And then as they progress, the cravings and those aspects, the withdrawal symptoms, they begin to fade. They become very secondary. The effectiveness of hypnotherapy for smoking cessation is somewhat mixed. So what I mean is even if you look at non-hypnosis psychological interventions for smoking cessation, approaches that involve just a single session, like one session, say to stop smoking, is not really effective. The research shows that at best, a single session of hypnotherapy for stopping smoking has a success rate of somewhere around 15 to 20% at best. So when we look at the effectiveness of hypnotherapy for smoking, we really need to look at interventions that involve multiple sessions. That really increases the effectiveness of hypnosis, and multiple sessions and sessions that are directed toward these different components of smoking cessation, such as withdrawal, developing coping strategies, developing stress management, getting through the psychological dependency, and so on. And so if we look at these multi-component, multi-session programs, like the Finito program, the success rate goes up dramatically. And so the research is really in the range of 60 to 90% of cessation, stopping smoking, as a result of that more intense type of program. And so that's really what we aim for, is a more intense, more in-depth program that gets that higher success rate.
Mm-hmm. And, can you talk a little bit about how hypnotherapy feels?
Sure. It feels good. Hypnotherapy feels good. It's one of the most pleasant experiences, because if you think about the response to hypnotic suggestion, it feels effortless. It feels easy to the person. And the session is really directed towards something that the person, they want to accomplish. And so if a person is listening to an audio recording or listening to a hypnosis session, they really just need to find a comfortable place where they won't be disturbed for 15 or 20 minutes, where they can close their eyes and just become very absorbed in the very positive and soothing suggestions that are given. And usually that involves a very deeply relaxed state, and then positive mental images, positive suggestions that really guide the person into this pleasant state of being, and one in which they can experience the suggestions that are given, so that most people really enjoy hypnosis. They like to do it. Sometimes, I ask people, you need to practice at least once a day. And the most common question that people ask is, can I do it twice a day? And of course, the answer is yes. You can. Each person should find what works best for you.
Okay, Gary, would you be able to tell us, how does hypnotherapy compare versus other quit smoking methods?
Well, it compares quite well. So other quit smoking methods, such as nicotine patches or medications and things like that, they have a success rate of about 35%. People stop smoking over the long run. And hypnotherapy programs really are a little bit better than that, in the range of 60%, possibly up as high as 90% in one study. So it compares quite well. It is a mind-body therapy, so it does involve something that the person learns and they practice. As we say, persistence pays off. So once a person starts a hypnotherapy program, it's important to stay with it.
Mm-hmm. And are there any dangers to hypnotherapy?
No, any dangers to hypnotherapy? Hypnotherapy is a natural state, so it's the state of focused attention. And so hypnosis in and of itself is simply pleasant, I guess few or no side effects. And so it's really a safe, pleasant experience.
So then why isn't hypnotherapy more common? Why aren't more people aware of it? Why aren't more people using it?
So I think there are a couple of things that that sort of affect, how widely hypnosis is used. If it was like a medication, I guess everybody would want something that's safe and effective and easy to consume. But there are really just a couple of different barriers. So one is the availability of well-trained hypnotherapists. And then the other is just a lack of awareness of the benefits of hypnosis. And so, it's one of the things that really gave me a great deal of interest in the development of the Finito app, because it makes hypnotherapy much more widely available. If there's something that people know is helpful, they have to have a way to gain access to it. And so if you live in an area, you don't have a hypnotherapist or someone trained, then, how do you have access to it? And so the Finito app really helps get past that barrier. And then the other is just people being aware of the research that supports hypnotherapy. And the research is really quite strong, but it's a complementary and alternative therapy, a mind-body therapy. And so there hasn't been the same degree of awareness of the effectiveness of hypnosis. And so making people more aware is the other very, very important aspect.
Mm-hmm. And then, does app-based hypnotherapy work as effectively as in-person?
That's been how effective is app-based hypnotherapy versus in-person sessions? That's been a question that I've explored in my research lab. And as an example, we conducted a study where we compared the two. So we randomized half the people to sessions in person with a therapist, and then the other half, it was self-administered hypnosis. So they received audio recordings and guidance, but they didn't have any sessions in person with a therapist. And we were hoping they'd be like comparable. What was surprising from that study was that the app-based hypnotherapy actually was superior to the in-person sessions.
Wow.
And so I was surprised by that. We tried to think about, well, why would that be? And I think there are a couple of really strong advantages to the app-based approach. First, it was convenient. People liked not having to schedule a time for an appointment and travel, that they could do this in their own time, in their own home, in their own way. And then the second is, if it's an app, you're the person who's responsible. You're responsible for listening to it, completing the readings, practicing with it. And I think people found this to be more empowering, that maybe there was more like a dependency on the therapist, but you take the therapist out, then it's really more empowering that you're the one who's achieving these positive results. So I think the evidence really points to app-based hypnotherapy. It may actually work better for some problems than seeing a therapist.
And so then what inspired you to create Finito?
For me, the background, the inspiration for Finito, it's both personal and professional. My father was a heavy smoker, and he knew that, smoking was having a bad effect on his health, but he struggled to try to stop smoking. And at age 69, he was diagnosed with an abdominal aortic aneurysm. And this is the big artery that goes to the heart. And if you smoke, that artery can become hardened, inflexible, and it can burst. And although he did get to surgery, it wasn't successful. And so he died from cigarette smoking. And so, you know, personally, it gave me a passion to want to help others stop smoking, and to be able to avoid this kind of tragedy that smoking cigarettes can lead to. Professionally, I spent a lot of my professional life examining the applications of hypnosis in a variety of areas. And so I really wanted to determine, how can hypnotherapy be made most effective for smoking cessation? And so a lot of my research is really focused on, how can we develop the most effective type of program and really bring it to the public. And so in working with Mindset Health and developing the Finito program, I think it's really achieved two goals that I'm very passionate about.
Mm. And I'm sorry to hear that, and thank you for sharing. I think that's probably something that a lot of people could resonate with. I think the statistics are about 1 in 5 deaths in the United States are actually related to smoking. So it's a global tragedy, really.
Yes, that's right. And it's not just cancer. You know, smoking leads to emphysema and cardiovascular disease. It's eventually catches up with most people if they continue to smoke long enough.
And so could you explain a little bit about, you know, what a user might be able to expect from Finito?
Well, from the Finito program, you can expect to learn about hypnosis and how it can help you stop smoking. With the Finito program, you'll get the information you need to understand how smoking affects the brain, how dependency on cigarettes happens, and how to set achievable goals to become a non-smoker. You'll learn how hypnosis works and how to practice self-hypnosis to reduce cravings, to increase your motivation, and really to change your lifestyle so that you become and you remain free from smoking. I will say it's important to stay with the program. The Finito program is one that is very effective, and it's important to never give up. Repeat it if you need to. But with the Finito program, when you're ready to stop smoking, you can expect to become a non-smoker.
Can I use Finito if I'm vaping or using nicotine patches or gums?
Yes, you can. If you're using nicotine patches or gums, you can also use the Finito program. And in fact, it might help you. If you're tapering down, as you know, is done with patches and gum, you can continue to do that as you begin to use the Finito program to develop hypnotherapy skills, and they can really be used in conjunction.
Yeah. And do I have to quit smoking straight away?
You do not have to quit smoking straight away. Many people find that tapering down to 4 or 5 cigarettes a day first is very helpful. And if you taper down first, it just makes the withdrawal symptoms a little bit easier for the person. So you're coming off that nicotine a little bit more easily. And so even if you taper down, and if you stop, if you say you have a lapse and so you start smoking again, it just means we'll go back and restart the program. You'll eventually get there, and just stay with the program, and you'll eventually achieve your goal of becoming a non-smoker, but they can be used together without any difficulty.
Great. And when can I start to see results from Finito?
So you can expect to see results immediately once you start the Finito program. That's because from the very first session, you're introduced to self-hypnosis. And so you'll experience the positive benefits of reducing stress and developing a way to cope with the cravings and the withdrawal symptoms right straight away from the very first beginning. As you proceed through the program, it will help you in terms of sleeping better and help you maintain your motivation as you go through the entire program.
And when is the best time to listen to these hypnotherapy sessions?
So the best time to listen to the hypnotherapy sessions is really whatever works for you personally. So, if you notice that you awaken in the morning and you're experiencing cravings, well, that's the time for you to have a hypnosis session. If you are able to get through the day and really it's in the evening that you experience cravings or withdrawal symptoms, then that's the best time to practice. A practice session is easy. It just takes about 15 to 20 minutes. And so most people can work in at least 1 or 2 practice sessions every day.
And what happens if I lapse and have a cigarette during the program?
So if you lapse and you have a cigarette, you really should think about it as an opportunity to recommit to quitting smoking. And that's because research has shown that as a person begins to quit smoking, it's a process. And so if the person has a lapse, their likelihood of success of eventually becoming a permanent non-smoker goes up, not down. So it's really not a failure. It's an opportunity to recommit to the process. You've learned something about yourself. You've learned something about the Finito program. And so you just restart and then continue the program, and then you'll eventually achieve success.
Mm-hmm. And say I've had severe withdrawal symptoms in the past when quitting. Will it be any different with Finito?
Yes, it will be different with the Finito program because the program is really designed to address those withdrawal symptoms right from the first. So as a person goes through withdrawal, that's really the dependency and the addiction involved with nicotine. And so if you don't have nicotine in your body, it's natural that you would experience waves of cravings. You might feel more irritable. It can affect your sleep. But the Finito program is really designed that if you're experiencing cravings, a self-hypnosis session will lead you into comfort and calmness until that craving, that wave passes. And then the experience of utilizing hypnosis in the evening or whenever you're ready to go to sleep. Many people fall asleep if they want to as they're going through a hypnosis session. And so it will feel much easier. The withdrawal symptoms, the experience of them will be milder as you go through with this kind of support.
Mm-hmm. And what about weight gain? So a lot of people will get concerned about quitting and then, gaining weight. Will the Finito program help at all with this?
It will. So you're right. It's a common concern that people think that if they stop smoking, they may gain weight. And that is true, especially if the person is eating, sweets or candy or high-fat kind of foods to cope with the stress of stop smoking. But really, if you think about stopping smoking, it's a health decision. And so as a person goes through the Finito program and they become a non-smoker, their breathing improves, they have more energy. And so the research really shows that although when people stop smoking, some people experience a very minor weight gain, a few pounds, but over the long run, they lose weight. And so non-smokers tend to lose weight compared to when they were smoking.
Mm.
Yes, it's the good news.
It's good news. And then what about cravings? You know, how long do they last? And what should you do if you get one?
So if a person has been smoking, let's say, 2 packs a day or something like, or 1 pack a day, and you set your stop date, you stop smoking, you'll experience cravings within about 30 minutes after stopping smoking. The cravings are really at their worst during the first 3 to 8 days after stopping smoking. And so it's really important to be confident that, okay, I'm going to experience these cravings. The Finito program will help me cope with those feelings, help me cope with those cravings. They will pass. They will become less and less. And so really, after you get past that first 8 days or so, they begin to taper down. By day 15, you'll notice a significant decrease in symptoms. And then by the time you get all the way to the end of the program, they pretty much, you got the nicotine out of your system. And so that's really where you start feeling normal again.
Mm. And, what do I do if I want to quit, but my partner doesn't, for example?
So social support is a very important part of stopping smoking. And so if you're ready to quit smoking, but your partner isn't, it's important to sit down with your partner and have a heart-to-heart discussion about it. Let them know that you're becoming a non-smoker. You need their support. And the most important thing is that your partner not smoke around you. So if they're going to continue to smoke, just get the cigarettes out of the house. Don't smoke around you. The reason is that if you're around a smoker, even if you're personally not smoking, you're still getting nicotine through the air that you're breathing. And so it's very important to help your partner understand that you aren't being controlling if you ask, please don't smoke around me, because it's necessary for you to completely get nicotine out of your system.
Mm. And what do I do if I smoke to deal with stress?
So that's a really good question, because one of the reasons people most commonly smoke is to deal with stress. And there are a couple of things to be aware of about that. So in the beginning, when a person hasn't smoked before, most people have the memory of smoking and feeling better. But that's not true for chronic smokers. Smoking actually causes stress because it's an addictive substance. If you don't get the nicotine, you feel stressed. And it's a vasoconstrictor. And so the person can get in this vicious cycle of smoking, feeling stressed, and trying to smoke more to reduce the stress. And so it's one of the beautiful things about the Finito program is that you learn another way to deal with stress. Stress management is a key component of the Finito program. And so you learn how to reduce your stress without smoking.
Mm-hmm. And after I've completed the Finito program, can I ever smoke again? Can I have one cigarette here or there? Will I become a smoker again? What would happen?
So can you smoke again after you after you completed the Finito program? The answer is no. Uh, you've gone through this process of getting the nicotine out of your body. And so once you become a non-smoker, it's important to not smoke again, not even a puff, because you're vulnerable. And so it isn't that a person couldn't smoke a cigarette and get right back on the program, but they've reintroduced nicotine into their body. And so it can re-trigger those cravings. And so it's important to not use any tobacco products, no vaping, no chewing tobacco, no smoking, as we say, not even a puff, after you finally become completely free from smoking cigarettes.
Okay. Well, thank you, Gary. It's been a very, very insightful Q&A with you, and I'm sure all of the listeners here really appreciate it. So thank you again for your time, and look forward to speaking again with you soon.
Okay, thank you. Okay, great. Thank you.